Hey, and welcome back. So, there's some interesting things in regards to vaccine development that have been happening here recently. And there's some history along with it too, dating all the way back to 1959. Now, there's not a whole lot I can find on this, but I found this article months ago and just didn't really have anything I could talk about on it. And now I do have something I can talk about on it. So, let's get into this. All right. So Canada is working on an inhaled Canadian COVID-19 vaccine to enter phase two human trials. They've already finished phase one, and they talk about it a little bit here. And essentially, they're working on something that you can just inhale, right? Now, a lot of people are a little skeptical on this. There was another article that I tried finding that was from Britain. Now, I'm not sure if it was some sort of scientific paper that they put together for peer review or what it was, but it was, I think, last year I found it. I wasn't able to find that one. It had to do with Britain, but I did find another one, so we're going to talk about that in a second. There is a pressing need to develop a new, more effective next generation vaccine strategies, said the McMaster's Vice President of Research, Dr. Karen Mossman, in a news release. As international leaders in the respiratory and mucosal immunity and vaccines, our research pivoted quickly with the arrival of the COVID-19 pandemic, drawing on an already strong inhaled vaccine research program focused on tuberculosis. Now, the tuberculosis part is actually the important part that I'm talking about here, because that ties back to 1959, and that means that they've been working on this potentially since around that time. So they say preclinical trials have already shown that the inhaled aerosol vaccines can be more effective at creating immune responses than injected vaccines, partly because it targets the upper airways and the lungs where respiratory viruses like COVID-19 enter the body, according to the release. Now, that's also very important because some doctors that maybe spoke out against vaccines, that is something that they brought up as one of the things that we should be paying attention to, because the vaccine enters an area, and the as you were saying, the area in which it enters changes on how well it can actually stop transmission and prevent a person from getting it. Because you want to, if you wanted to actually stop a person from receiving COVID, you need to stop it where it enters the body, right? And that's what they're talking about here. And so they say during phase one human trials, researchers have evaluating dosage and safety in 30 healthy volunteers who had at least two shots of the mRNA vaccine, like those made by Pfizer and Moderna. Now, the most important thing to make sure we are aware here is that they are only testing this in people who have received an mRNA shot for the phase one. And phase two, it's going to be, think it said 500 people with other health conditions, so not healthy people necessarily, who have had at least 3 mRNA doses. And phase two will be conducted with the help of $8.2 million in new federal funding from the Canadian Institutes of Health and Research. So I'm going to go take a look and see what we have in terms of some information in that regards. Dr. Fiona Smale, I'm going to assume Smale, not Small, is a professor of McMaster's Pathology and Molecular Medicine Department, and one of the leaders of the clinical trial, which also includes collaborators from Dalhousie University in Nova Scotia and the University of Ottawa. So this is it's good to see that it's not just one place that's looking at this, that it's quite a few different places. I have no clue. Like University of Ottawa has been in the news a few times. Dalhousie, I haven't really seen them, so I don't know, how they sit with, all of the things and stuff and things. But anyways, it says, if we can show the new inhaled vaccine is safe and effective as we anticipate, the impact will be significant for human health, medical costs, and better quality of life. So essentially what they're saying is they believe that this is going to be a much more effective vaccine, and it very well could be, right? And that it'll be easier and more readily available and cheaper to be able to get out to the people. And I think one of the things that we can all agree is that, It'd be nice to have something that was cheaper because when the government loves spending money. So regardless what they're spending money on, we should make it as cheap as possible. Um, Down here, the last little part that I want to show you, amid pandemic fatigue and declining booster numbers, the researchers hope an inhaled vaccine will be more convenient and appealing than needles. And they anticipate their work will help advance inhaled vaccines for respiratory infections like tuberculosis and influenza. Now, as we remember, it was originally being tested for tuberculosis, and that's what the study was. So I'm going to show you. Oh, gonna get my mouse over here. We're going to bring up. Oh, 1 second. All right. So this is. I wasn't able to crop it properly for this, but as you can see on the side here, it's from Time Magazine. And the date is Monday, June 8th, 1959. Medicine Airborne vaccine. So the one that Canada is working on is an inhaled vaccine. It's not an airborne vaccine. Right now, I know conspiracy theorists will love this, but all I'm doing is I'm just showing articles from, as we can say, reputable sources. But anyways, let's get into this. So, if tubercle bacilli can float through the air and cause disease in people who inhale them. Why cannot weakened bacilli be transmitted the same way to achieve mass vaccination? This was a question that Dr. Gardner Middlebrook and his colleagues at Denver Research Wise National Jewish Hospital asked themselves. Late last week, after years of testing, they gave the National Tuberculosis Association a tentative answer. No reason why not. Now, essentially, what they did, because I'm not going to read this word for word, but you can read it for yourself. Essentially, what they did is they took a weakened version of the virus, which is what a lot of vaccines are made out of. They put a bunch of rat or guinea pigs, 1,000 of them, as you can see, into a chamber, and they put this into the air supply going into the chamber, and then they've, allowed it to, do its thing, right? Then later on, they went and they introduced the tuberculosis germ into that air, and the guinea pigs lived a good life. They didn't get sick or anything like that compared to a control. And they also did a control here. They didn't say how many were in the control, I don't think. Nope. Yeah. And then it looks like, I don't know. It looks like they may have tried it in humans as well. But anyways, so this is just some of the interesting things. So I'm going to post both of these down in the comment or description of my video so you can take a look at that yourself. But yeah, just to give you an idea of what we're looking at in regards to inhaled vaccines. Of course, this is some of the conspiracy nut stuff that gets talked about. Like back in, I think, 2010, there was a post going around, or 2017 or something, about how you get onto a plane and they're using the air conditioning, but the airflow in the airplane to be able to introduce vaccines. And there was a woman that was, yada yada. There was a few doctors that wrote a paper on it, and actually wrote a paper on a lot of the different conspiracy theories. And some of them, in my opinion, I don't agree with at all. But some of them, like this one, are 100% possible. It's just maybe not at the time that they were being done. Now, I'm not saying any of this is 100% true other than what I'm reading to you, because, well, it is what it is, right? Like, we are working on inhaled vaccines. There has been research done with tuberculosis and inhaled vaccines in the past, and that's the only connection that we can see right now on what's going on. So this is just something for you to see what's going on, because a lot of people don't pay attention to CTV News or, the Time Magazine or anything like that these days because, well, they don't trust them, right? And they don't trust them at all. So I do my best to get my sources from everywhere and try and find credible information wherever I can. And that's what I did for this one. And if you don't normally pay attention to that stuff, thank you for joining the video, because, well, now you're seeing a little bit more of the story that normally people wouldn't see. So you have yourself a wonderful day, and we'll talk to you later.